day, listeners, and welcome to DDM Health News Updates. Health experts are raising the alarm over a concerning increase in fast food outlets across England, with new data revealing a growing density of takeaway shops per 100,000 people. The figures released by the Office for Health Improvement and Disparities, OHID, have been met with strong criticism from public health advocates, who argue that the expansion of unhealthy food options is undermining efforts to promote healthier eating. The latest analysis from OHID highlights a troubling trend. Fast food establishments are proliferating at a time when obesity rates continue to rise, particularly in areas of higher deprivation. Camden in North London now tops the list, surpassing Bury in Greater Manchester as the area with the highest concentration of fast food outlets per population. Other hotspots include Blackpool, Manchester, and Tower Hamlets in London. Catherine Jenny, director of the Obesity Health Alliance, OHA, has described the findings as infuriating, criticizing the food industry for prioritizing profits over public health. She argues that companies should be incentivized to promote and sell healthier food rather than contributing to an environment where fast food is the easiest and often the most to fuel the obesity crisis. Becky Elliott, head of policy at the British Heart Foundation, BHF, echoed these concerns, emphasizing the disproportionate impact on deprived communities. She stated, the easy availability of fast food is detrimental to heart health, particularly in areas already struggling with high rates of circulatory and cardiovascular disease. Our food system continues to be deeply unfair, making healthier choices harder for those who need them most. Experts warn that frequent consumption of fast food, typically high in fat, salt, sugar, heightens the risk of obesity, heart diseases, and other serious health conditions. According to Dr. Jordan Beaumont, a food and nutrition lecturer at Sheffield Hallam University, individuals exposed to high concentration of fast food outlets are up to 50% more likely to consume fast food regularly. Furthermore, research shows a direct correlation between deprivation levels and fast food density, reinforcing disparities in health outcomes across the country. Local authorities responsible for planning and licensing food businesses are now being urged to take stronger action to curb the rise of unhealthy food environments. While recent updates to the National Planning Policy Framework provide some measures to build healthier communities, campaigners insist that more decisive action is needed. Tracy Parker, a senior dietitian at the British Heart Foundation, BHF, warns that frequent consumption of takeaways, often high in saturated fats, salt, excessive calories, and sugar, contributes significantly to the risk of heart attacks, strokes, and other cardiovascular conditions. Health experts are now calling for policies that not only regulate physical fast food outlets, but also addressing the expanding virtual food environment, with outline delivery services making unhealthy meals even more accessible. As the debate intensifies, the message from public health advocates remains clear. Urgent intervention is needed to counteract the growing dominance of fast food and ensure that healthier, more affordable options are available for all. Whether policymakers will take bolder steps to tackle the issue remains to be seen. With the stakes higher than ever, the challenge ahead is not just about limiting fast food access, but about transforming the broader food environment to support better public health. As this debate unfolds, one question lingers. How long can we afford to let the fast food industry profit at the expense of public health? We will continue to monitor developments on these critical issues. Next, in a concerning development, cases of tuberculosis in England have surged by 13% over the past years, according to the latest data from the UK Health Security Agency. UKASA. The number of reported TB cases rose from 4,850 in 2023 to 5,480 in 2024, marking a continued upward trend in recent years. Despite this increase, England remains a low-incidence country for TB. However, the rate of infection has climbed from 8.5 cases per 100,000 people in 2023 to 9.5 per 100,000 in 2024. Alarmingly, 81.5% of TB cases have been identified in individuals born outside the UK, though cases have risen in both UK-born and non-UK-born populations. TB continues to be closely linked to social and economic deprivation, with the highest spikes recorded in major urban centres, particularly in London and the West Midlands. Among UK-born individuals, the disease is more prevalent among vulnerable populations, including those experiencing homelessness, substance dependency, and individuals with ties to the criminal justice system. Globally, TB has now surpassed COVID-19 as the leading cause of death from a single infectious agent, underscoring the need for vigilance. Dr. Esther Robinson, head of the UKAS TB unit, has urged individuals, particularly those arriving from high TB prevalence countries, to familiarize themselves with the symptoms and seek medical attention if necessary. A persistent cough lasting more than 3 weeks, especially with mucus, should not be ignored. Well, we want to hear from you. Have you or someone you know been affected by TB? Do you believe public awareness and screening efforts are adequate? What measures should be taken to curb these rising cases? Please share your thoughts with us in our comment section. Your insight could be help shape the conversation on tackling this pressing public health challenge. And don't forget to share, like, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. Until next time, I am Nyenyor Michael Inezine.